Minding Singapore's mental health, the government is making this a key national priority. It's adding more doctors under a national strategy, ramping up services at facilities like the Institute of Mental Health. Plus, there will be support beyond the healthcare system, stretching into where people live, study, work and play. Speaking in Parliament, Deputy Prime Minister Lawrence Wong explains that today's broad spectrum of mental health challenges calls for a broad suite of solutions.
Improving mental health is not just about hiring more psychiatrists or building more capacity at the IMH. We certainly will do that. But we also need to strengthen capabilities across our entire spectrum of care, including at our polyclinics and GPs, and across other settings like schools, workplaces, and the community, so that more timely support can be rendered to those in need.
Well, DPM Wong was speaking on the second day of a parliamentary debate on how the government will deliver on a national mental health strategy announced in the last quarter. Close to 30 MPs called for steps to make mental health services more affordable and accessible and to ramp up manpower and capacity. So, by 2030, the government will increase the number of psychiatrists in the public sector by about 30% to a total of 260. It's also looking to increase the number of psychologists by about 40% to 300. There will be 70 more beds for psychiatric patients at Alexandra Hospital and 500 more for care facilities like psychiatric nursing homes. Mental health services will also be available at all polyclinics and 900 more Healthier SG GP clinics. Plus, more training for another 28,000 frontline personnel and volunteers serving in the community so that they can help identify people struggling with mental health and offer assistance. There will also be more support for students, parents, working people, and national servicemen.
These are significant moves. They will require more coordinated efforts across the government, more training, more people, and ultimately more government spending. But we will set aside the resources to advance this important agenda. Through these moves, we aim to reduce waiting times and make mental health services more accessible and closer to where individuals are, be it at homes, schools, or workplaces.
A crucial part of the National Mental Health Strategy involves a model where mental health support is split across 4 levels and extends beyond the conventional healthcare system. The Senior Minister of State for Health says that the tiered levels of care would ensure that people with mental health needs receive the right support at the right time. Sabrina Ng breaks it down for us.
From your family doctor to social workers and even teachers, these will be the people you can count on if you're in need of mental health support. It's part of Singapore's shift towards a new tiered care model that goes beyond hospital walls. The aim is to better address the broad spectrum of mental health needs by tapping a wider range of resources.
Our overall goal is to improve access to care and mitigate an unwarranted medicalization and to reduce stigma. Because not every mental health issue needs to be addressed by a psychiatrist, just as not every medical condition needs to be treated as an inpatient by a specialist.
The model involves 4 levels of mental health support. They go from Tier 1 for mild cases where parents and teachers can help, to more severe Tier 4 cases that may require long-term intervention and hospitalization. It's part of a bigger strategy that shares the burden of mental health support and also equips networks beyond the healthcare system to address the needs of specific groups. Youths aged 18 to 29 are of particular concern, accounting for the largest population of people with poor mental health in Singapore.
To support youths at risk of suicide or severe self-harm, an intermediate residential facility will also be developed. Not all youths who present with suicidal behaviour suffer from mental health conditions. Instead, they may have experienced social stressors such as having difficulties coping with schoolwork and being bullied. Therefore, this facility will cater to this group of youths aged 10 to 19 years old to support them within a safe environment.
The mental health strategy also links seniors up with community volunteers to tackle issues like loneliness and provides dedicated support to caregivers at risk of depression and burnout. For the workplace, the Manpower Ministry is launching a 5-minute version of its iWork Health survey for companies to gauge how stressed or burnt out their employees are. The ministry is also looking to make it easier for people recovering from mental health conditions to get back to work.
We're looking to help employment support agencies expand their partnerships with trade associations and chambers to encourage more companies to come on board to hire and retain employees recovering from mental health conditions.
Ultimately, the message behind the strategy is that mental health is everyone's business, and managing it well is the nation's prerogative.
Singapore is also reviewing private insurance coverage for mental health. And this follows concerns raised by MPs that some private insurers are denying coverage to people with mental health conditions. Senior Parliamentary Secretary for Health and Law, Rahayu Mazam, says that this is unacceptable.
MOH and the Monetary Authority of Singapore, MAS, fully expect all insurers to deal fairly with their customers. Insurers are expected to carry out an objective assessment of every application based on reliable information or data relevant to the risks being insured. Insurers should not indiscriminately reject an application solely on the basis of declared personal information, including mental health conditions.
Wrapping up the two-day debate, MP for Jalan Besar GRC, Wan Rizal, says that the debate amplifies the urgency to overcome stigma around mental health issues. Dr. Wan Rizal is among 5 MPs who filed the motion, and he calls for a society where mental health can be openly discussed, supported and prioritised.
Our mission is clear: to foster a society where conversations about mental health are met with open arms and understanding hearts, not judgment. We need to cultivate an environment that encourages everyone to seek help without fear, to talk openly without shame. The mission spans across every facet of our society, from our schools to our workplaces, from our healthcare institutions to the very fabric of our communities.